Hey, my friends, we will be right back to the show. But I have a question for you. Are you struggling with the impact of childhood trauma? Well, know that you're not alone. I'm here to let you know that I'm starting a brand new weekly coaching group that includes a year of life coaching, accountability, support, habit and goal setting, and more. I'm starting a waitlist for the group right now, and I'm only taking a handful of people. And I'll let you know that through this personalized coaching, we'll work together to help you understand how your childhood trauma has shaped your beliefs, behaviors, emotions, and will help you create a roadmap for healing and growth. Right now, you can schedule an absolutely free coaching session with me and get put on the wait list if you go to thinkunbroken.com. My friends, it's your time to turn your trauma into triumph, breakdowns into breakthroughs, and become the hero of your own story. And I'm here to support you in doing that. Just go to thinkunbroken.com to register for a free coaching call with me and to get put on the wait list for the brand new weekly coaching program. We'll be right back to the show. But before we do, I want to tell you about today's sponsor, factormeals.com, where if you go to factormeals.com/unbroken50 and use the code unbroken50, you can get 50% off your first order. That's factormeals.com/unbroken50. If you're like me and you are a person who is busy trying to create a life, heal, work on their health, wealth, and relationships, and not to mention deal with the day-to-days of normal life, you do not have time to be going to the grocery store and trying to figure out what you're going to cook every single day of the week. In fact, one time I did the math and I realized I was spending over 15 hours a week at the grocery store and cooking. When I added Factor, I got to use that time for myself, for my family, for my friends, for my community, and for my business. And so if you're in the place where you need some more support in the kitchen, head to factormeals.com/unbroken50 and use the code unbroken50 to get 50% off. Hey, my friends, we will be right back to the show. But I have a question for you. Are you struggling with the impact of childhood trauma? Well, know that you're not alone. I'm here to let you know that I'm starting a brand new weekly coaching group that includes a year of life coaching, accountability, support, habit and goal setting, and more. I'm starting a waitlist for the group right now, and I'm only taking a handful of people. And I'll let you know that through this personalized coaching, we'll work together to help you understand how your childhood trauma has shaped your beliefs, behaviors, emotions, and will help you create a roadmap for healing and growth. Right now, you can schedule an absolutely free coaching session with me and get put on the wait list if you go to thinkunbroken.com. My friends, it's your time to turn your trauma into triumph, breakdowns into breakthroughs, and become the hero of your own story. And I'm here to support you in doing that. Just go to thinkunbroken.com to register for a free coaching call with me and to get put on the wait list for the brand new weekly coaching program. Welcome to the Michael Unbroken podcast. I'm Michael Anthony, author, speaker, coach, mentor, and advocate for adult survivors of childhood trauma. And in this podcast, I'm going to be bringing you the best of what I understand about healing trauma, overcoming our past, and ultimately becoming the hero of our own story. This podcast is not a replacement for mental health, but instead, think of it as a companion to help guide you into what is next in your life. My friend, thank you so much for being here with me. Do me a favor before we get started. Hit subscribe, like, comment, leave a review, tell a friend about it. And until next time, my friend, be unbroken. Let's get into the show. Have you read my book, Think Unbroken, Understanding and Overcoming Childhood Trauma? If you haven't, then now is the time because I am giving away free copies of my book, Think Unbroken, for the rest of the year. All you have to do is go to traumahealingbook.com to get your free copy. The reality is that as I think about the world and where we are right now with things, it is more important than ever, if we are going to step onto the path of healing generational trauma together, that we do it through education. And when I wrote my book, I never expected it to become an international bestseller. I certainly didn't expect it to sell thousands and thousands of copies as it has. And the one thing that I know to be true about this experience is that the more people that read it, the more impact we can have on the world. And so I invite you to read it for free at traumahealingbook.com. I only ask that you cover the shipping and handling. And the reason is because, I'm just a regular guy. I'm not a millionaire, and I would go into debt if I gave everyone in the world a free copy of my book. So I'll cover the book, you cover the shipping and handling, you grab your copy at traumahealingbook.com. And I'm so excited to have you on this journey and this mission to think unbroken. Hey, what's up, Unbroken Nation? Hope that you are doing well wherever you are in the world. I am Michael Anthony, author, speaker, coach, and advocate for adult survivors of childhood trauma, and you're listening to the Michael Unbroken podcast. Today, I am joined by Dr. Ken Adolph, a certified board cardiac anesthesiologist, which, wow, the amount of effort and work that takes just to get that title, Ken. Plus, more importantly, the conversation that we're going to be having today around ketamine therapy. I'm super excited about this one. Ken, my friend, how are you today?
I'm great. And thank you again for having me on, Michael. This is going to be very interesting.
Yeah, it's my pleasure. First and foremost, before we jump in, can you tell everybody a little bit about yourself?
Sure. So you stated that I was a cardiac anesthesiologist. That's true. I've been in practice for about 20 years here in Austin, Texas. That's been my primary place of practice is in one hospital and providing care for, patients who are undergoing heart surgery. Most people would be out there asking, well, how in the world did you get connected to ketamine, and how what is the connection? But before I get to that, I will want to, reach out to everyone that I am a sufferer of generalized anxiety. And so from the beginning of training, I knew that this was going to be a long journey for me, because the stress and the anxiety that I was fighting against, I felt alone. I felt silent and ashamed, because I felt like I needed to be Superman, and I needed to put a cape on and be everything for everybody at all times. And that left me, again, alone and not connected. And so most of the time that I was in practice, I felt disconnected and I felt on the outside. And part of that is my upbringing, and I'm sure that most people out there can certainly identify with that it's really, I did not feel as though, I felt like I was grew up as an athlete mostly, and then suddenly turned the stern of the ship into becoming a student and eventually a physician. So I really want to make that known to everyone out there, that even though wow, it's a wow, it's also, it doesn't come without a certain amount of stress. And from stress, of course, we know comes some trauma, related to that. Although that's my perception, that's my trauma perception.
Yeah, and I think that holds true for so many people. Not only being under the stages in terms of under the lights, in terms of on the stage of the playing field,
Yeah.
but also now in academics and academia, and being deeply thrust within this thing, and expectations are high. And I think about stress, anxiety, and depression, which often tend to kind of loom within each other. And then you're often, if you hadn't experienced anything like mine, being dissociated and disassociated and kind of just having this outer body experience commonly. I want to dive into that, but first, as we kind of head into this, what was the moment in which you, I think two things are going to be really important to have as a precursor to this conversation, Ken. One is, talk to me about the thing in which ketamine made you curious. And then two, what is ketamine?
Okay. First, I'll tell you what's ketamine, and then I'll answer how I became interested in it. So ketamine is actually an anesthetic, recognized as one of the most broadly used anesthetics. It's even used in veterinary medicine in the world. And so it's very important to keep it where it is and, utilize it in a safe manner. So it was developed because in World War II, our veterans on the battlefield were dying of morphine overdoses. It was a standard dose IM injection, meaning intramuscular injection through the pants, with someone who was, of course, gravely injured on the battlefield. And that was causing respiratory depression. So the same thing that we're seeing now with deaths with opioid epidemic that we have in this country, we see deaths related to respiratory depression. Ketamine was developed so that we had a safer drug in the battlefield. And so it was called the buddy drug. Ketamine increases heart rate, increases blood pressure, and it does not decrease respiratory drive. And so very safe drug because it's an analgesic and does hit the opioid receptor, which so does morphine, but it hits a lot of other receptors. So initially it was developed as an anesthetic, and it is in its own class. It was described as a dissociative. So what ketamine does is it basically allows your brain to drift off into the unconscious because you no longer have the sensation or the body sensory input that's coming to your brain. So you can literally perform, small surgical procedures, even in the field, setting an arm that's broken, shoulder that's dislocated. So it's a lot. And like I said, very safe drug used in ERs, in pediatric hospitals. And you could imagine in veterinary medicine, you wouldn't want to have to control the airway of a giraffe or a horse, or, so that you want to keep them breathing. So most of the time when you see that shot that's a dart that goes into a tiger, that's ketamine, because it will sedate them safely and allow them to continue breathing. So that's kind of ketamine in a nutshell. And then the connection for me is, of course, I'm familiar with it and the use of it because it's so safe. And being that it doesn't decrease heart rate or decrease blood pressure in the cardiac operating room, we need drugs that are cardiac safe. And that is a cardiac safe drug because of those things. And so if I have someone who's very ill from a heart standpoint, where their heart isn't pumping or squeezing adequately, I can provide an anesthetic up front that will allow them to be anesthetized safely.
Can you talk about the differentiation between ketamine in this medical practice styling versus what I am used to growing up on the streets being Special K?
Exactly. So, I mean, in the operating room, we're mainly using it for an anesthetic. And it's really, when you need an anesthetic, you need analgesia, you need amnesia or amnestic, where you don't remember things. And you also need it in a dose where it's going to be, again, safe. And so just like many of the drugs, fentanyl is a drug that's used in the operating room. It does make its way to the street and it's used illicitly. But, it also can be brought back into looking at it as a therapeutic way of being able to help patients in other ways. And so back in the 90s, they began to recognize, again, in the military, that in the burn unit, soldiers who are having debridements when they're burned, they have to go through multiple different operations, essentially, where they're having this excess burned skin taken from their body. There were a group of patients that were receiving a drug called propofol. You may be familiar with that, with Michael Jackson. The other patients were being anesthetized with ketamine, and they would come out of these experiences reliving some of their traumas in the battlefield and being able to process them. And so that began the thought that, wow, these guys are having less, PTSD long-term. Maybe there's something that we can look at here. And so it began a process of where we started to utilize many different modes. I mean, I won't go into detail of the studies, but essentially utilizing ketamine as a dissociative. You use that term, dissociation. This is a dissociative drug, meaning that it allows you to escape the input of your body, and so that you're just basically free to roam your unconscious.
What is it about this drug particularly that makes it so efficacious in treating things like depression, anxiety, mood disorders, suicidal ideations, things of that nature? Because
Right.
years ago, I started doing research on ketamine and still to this point have not tried it, but I'm incredibly curious about it. Because you go look at research and white papers anywhere from Harvard to beyond, and everything points to this efficacy rate in the high 80s to even 90%
Yeah.
rate
Right.
in treating these ailments. What is it about ketamine that is so much different than all the other efforts that we see in pharmacology?
So I'm going to make a point of being able to answer your question, but I'm going to ask you to remind me on the back end, integration, integration, integration. So we can talk about that after, because for me, the molecule affects a receptor, and it puts us in a state of mind that allows us to see our life through a new lens. We again have to take that information and begin to process that. So to answer your question from a scientific standpoint, even in low doses, what ketamine does is it allows our prefrontal cortex and our hippocampus to no longer communicate. So when we get into the rumination cycles that we do when we're depressed or when we're anxious or when we've experienced trauma, we cannot get out of that loop. Even with suicide, it applies to eating disorders with, body dysmorphia, where we constantly are in this loop where we can't get unstuck. And, ketamine allows us to be able to, for just a second, set aside the default mode network. I'm not sure if some of your listeners are familiar with that, but that is that loop. And the default mode network will turn off when we undergo a ketamine infusion. And it's allowing us to be able to, number one, sever that rumination loop, allow us to be able to, again, have, moments of gratitude, have moments to realize that our life is important, that we are interconnected in many different ways. And again, ketamine is in these effects are dose related, and we can get into that if you'd like, but that's really what ketamine is essentially so powerful in. It's being able to stop that rumination cycle just for a moment, for that hour.
So effectively, then what is happening is you're looking at a chemical reaction happening through this being administered intravenously.
So there's several different routes. So intravenously is the way that we do it at Illuma, our clinic here in Austin. But there's other ways. You can give it intramuscularly, and it's, for bioavailability, the amount of drug that's available to the brain is very high for IV. It's 99 to 100%. But for IM, it might be 93 to 94%. You have, uh, the the benefits of having IV is that if a patient has suffered trauma and they're undergoing a reliving or a revisiting of that experience, we can turn the infusion down if they're starting to feel uncomfortable, or we see that they're moving around, or almost trying to get out of the chair. IM, it's in your body, and it's either having to give another drug to help with that, but with IV, it's turning it on or turning it off. And so that's
So
definitely the benefit.
one of the things I'm very curious about, so if you're in this space, and let's pretend for a moment, Ken, I have absolutely no idea anything we've talked about to this point, and I'm
Sure.
really not connecting the dots on what ketamine is or does or why it's potent and efficable in trauma therapy or therapy in general. At a high level, if you were to simplify this in 2 sentences, what does ketamine do in regards to mental health?
Okay. So instead of concentrating on the science, because sometimes you can get confused because ketamine just doesn't act at the NMDA receptor and block that. I mean, we can get into the science of it, but to be completely um, basic and broad is that it allows that patient to be able to escape essentially the rumination that they've been undergoing, the narrative that they live on a daily basis. and look at their life through a different lens. And when they come out of that, they're able to sit with a therapist who has experience with ketamine, who can guide them through being able to know what that experience is like, to be able to say, let's look at that experience. Let's look at how you saw that experience or how you relived that experience, to be able to guide them. Because one of the most important things about ketamine is that it releases something called BDNF, brain derived neurotrophic factor. So the neurons that we have that that atrophy, they kind of shrivel or shrink. Like if we think of a tree, some of the neurons that are used in those connections, they are no longer firing. So ketamine wakes them up. And so we're able to, rewire the brain, so to speak. And so when we begin to think more positively, where we are able to relive that experience and form new memories so that we can see what our lives are about in a different light. Are you familiar with the term narrative identity?
Yeah, I am.
So,
But for those who are listening, please feel free.
no, I mean, I think that, memory is so important. And I think that anybody out there who has lived a life of, multiple different traumas, or like you said, where they've experienced dissociation, to be able to deal with that trauma, knowing that ketamine can be an essential part in breaking the narrative of any individual, is important to know. And what I mean by that is that experience in anyone's life can form your story. So just like you asked me, if you ask anybody, tell me about yourself. If someone starts off with, the the pain that they're suffering from, that it's inescapable, and that they're unable to function in their life, that becomes their narrative, and it can affect everything from their mentation to their somatic response to those thoughts. And so when I say narrative, it becomes who they are, and to the core, feeling like a broken person.
Yeah, and I would have to think like part of this is also a reclamation of your body. Like,
Yeah.
what role does that play? Because as someone who went through a lot of trauma and dealt with chronic pain for a very long time, one of the things that I noticed in sync was, as my mental health got better, my physical pain started to reduce. And it's not that I still don't have physical pain I have to deal with, having, a chronic health issue, but what role does ketamine play in that?
I believe that, like you said, you've noticed that in the work that you do, that those those physical symptoms are beginning to alleviate. I believe that when we suffer trauma, or when we suffer long-term depression and anxiety, it begins to manifest as physical symptoms if we do not face it or we do not deal with it. I call it whack-a-mole. I mean, it happened to me in my life where, my chronic anxiety turned to panic attacks. Had no idea why they were coming, but it's my brain forcing myself to say, I can't control my heart rate. I become out of control. And, if you're an anxious person, that's what we deal with. We want to be in control of our lives. And if we don't face our real true emotions, the core wound, I believe that it will manifest as chronic back pain, chronic neck pain, shoulder pain, fibromyalgia, um, dysautonomia. I don't know if people are familiar out there, where you get dizzy spells. We see all of these things in the clinic, where patients come in and they've gone through a battery of tests with multiple different physicians, where they see that they have no way of, or no answer to their physical symptoms, but they really aren't addressing their psychological issues.
Yeah, I literally could not agree with you more. And that was my experience too, because I had this moment where I noticed I was having 4 to 5 panic attacks a day.
Yeah.
And the thing that dawned on me in that moment, Ken, was wow, you have some shit you need to work on, because
Right.
this is your body and your mind trying to expel the chaos that you're consuming. And, for me, speaking as a man, it was just like, push it down, push it down, push it down. And eventually, you can't push it down anymore. It is a boiling pot ready to explode. And then it kind of just destroyed my life for a while, because I had to pause and go, what is really happening? What is the long-term efficacy of ketamine here? Because what I'm concerned about in the context of this conversation, not fully understanding it and realizing it to this point, is how how does it play on the long-term game? Is
Right.
this an immediate quick fix? Is this something that works for 20 years down the road? You do one IV and you're good to go. Talk to me a little bit more about the long-term impact of usage. Hey, what's up, my friend? Before we get into today's episode, just want to take a moment of your time and tell you about the 30-day Think Unbroken small group trauma healing challenge. What I've done is taken the best of everything that I've learned over the last few years of being a trauma-informed coach, through my own certification processes, through my own trauma healing journey, and more, and compiled it into the most in-depth 30-day challenge that's ever existed in healing trauma. And I want to invite you to it. If you go to healtraumacoach.com, there's more information, but as a quick overview, you're going to step into not only learning the baseline of healing through the 6 principles of healing trauma, but the 6 pillars of healing trauma, through reframing, through creating self-love, through understanding personal boundaries, through creating wants, needs, and interests, through understanding your ACE score and how that impacts you, including the science of trauma, and more. And I created this challenge because I want us to come together as a group and as a community. And one of the things really special about this 30-day small group coaching challenge is not only will you go live with me weekly as we go into the depths of healing trauma, but also you're going to be assigned to anonymous teams where you can remain anonymous and have support and have community. Think of it like a digital support group, but you don't have to show your face or say your name. One of the reasons that I did that is because in my own journey, the most powerful moments that I had were within these groups, and I want to give that to you as well. So I invite you to check out healtraumacoach.com. The first session starts on April 1st. I'm only allowing a handful of people into this first session. So if you're curious and you want to know more, check out healtraumacoach.com, and I will see you in the challenge.
So I think that that's going to be patient dependent, of course, just like anything else. I mean, we have patients that come in that are suicidal, and the best thing about ketamine is that it's been shown to be effective for extinguishing suicidal ideation within 24 hours. You know, within an hour of having an infusion, that idea or that rumination is gone. So that's one end of the spectrum. We also have the other end of the spectrum, which are high functioning, which I call high functioning individuals who are suffering from, you know, perfectionism. They have this just unwielding need to succeed, and that is keeping them up. They have terrible sleep patterns. They, you know, are trying to use Adderall to be highly effective in their lives, and then using Ambien or something else at night, and they're just completely out of sync. So what that spectrum looks like is that we have to have a care plan for each individual, and have it carried out effectively for each person. And what that may look like is that for someone who's suicidal, that we require that they have a psychiatrist, that they have a therapist that they're seeing, if not, you know, especially in that, if they're suicidal, on a daily basis initially. And then eventually, when we start to get out from a month after they finish, let's say 6, which is what we do at the clinic, is 2 infusions a week for 2 weeks, and then 1 infusion a week for another 2 weeks. And that is just the beginning sometimes for those patients, where they've broken the cycle, they've broken that rumination, and now they're doing the deep work, where they may be undergoing ketamine assisted psychotherapy using an oral form. There's also a nasal spray form. So that looks very different than the high functioning who suddenly maybe sees in the middle, maybe the 3rd infusion, aha, I see what I'm doing to myself. As they're finishing their series, they're like, I have such an appreciation for where I am. I have this renewed love for my family. I've noticed that I have broken relationships because of my need to succeed and to be this perfectionist and have this, materialistic drive. They will again have a very much uh, more changing diet, using yoga, meditation, integrative practices that are more self provided, and that not not that the person that is suicidal may not get there, but they need a slower progression through this process, that maybe a year to that we even begin to think of changing other things, to talk to them about coming down off of medications. Because I'm not sure if, how in depth you've talked about SSRIs and what this country is, how difficult it is for patients to get off of those drugs. Ketamine can help that.
Yeah,
Help that.
I don't typically go that route because for me, I had just an incredibly awful experience when I was trying pharmacology in my mid 20s. And it felt to me like to numb myself would defeat the purpose of trying to put myself in a position to become mentally astute and healthy. And it's something that I'm constantly curious about, reading research, trying to understand it. I just found for me it wasn't the right fit, whereas other things were non-traditional, from LSD to psilocybins, really played a beautiful role in my healing journey. In regard to ketamine, one of the things that I'm immediately curious about, does it in any way inhibit the release of cortisol?
No, not that I know of. I mean, it has a cascade of 100 different things. It mainly it's an antagonist at the NMDA receptor, which creates a flood of glutamate into the brain. And not many people know, because we hear of serotonin, norepinephrine, dopamine, some of the other neurotransmitters, but glutamate is really the workhorse in our prefrontal cortex of forming memory. And that's why it's so important, because it can reform memory. We can rewire our brains because we have the ability, our brains are fraught with I mean, being able to process memories is different for everybody. And like you said, with dissociation, our brains shut off. And so those memories will be very different from person to person, even experiencing the same traumatic experience. We've seen that in science. And so, again, I am also a believer, as you are, with psychedelic medicine. I mean, ketamine is a psychotropic. I'm excited to see psilocybin and MDA be researched as it is being now, and I think that it's the future of mental health,
Yeah.
as far as care.
I agree with you, and it just makes more sense.
Yeah.
Why, which brings this point, and looking at the prescription drug epidemic in this country, I mean, it's taken multiple members of my family, including my mother, who was addicted to SSRIs, could not get off, and then that story goes and goes and goes. But looking at the impact that it has across this nation, and yet we have these, for the most part, natural occurring substances in the environment in which we live, and them being cast a shadow because they can't be controlled by pharmaceutical companies. Now, this is not to go on a tangent about conspiracy therapies, and Eli Lilly and things of that nature.
Yeah.
What, to make a point, why is ketamine not more readily available as an instantaneous treatment in these scenarios?
Well, it is, first of all, because it's a Schedule 3 drug, and it can be used as an off-label, for what we're doing. So there's nothing illegal about it, and it's not underground, obviously. It is the one psychotropic, that we have that can produce these experiences that are similar to psilocybin, similar to LSD, that allow patients to, again, experience their subconscious. I truly think that the difference between ketamine and those compounds that you talked about are that ketamine allows you to experience these things subconsciously, like in a dream state. And it allows your brain to process them the way that our brains are allowed to take in the information. And so oftentimes when I wake up after an infusion, I just feel light and less triggered. And I mean, it's a freeing feeling. And so, you know, it's again, the further out that I get, you know, we've been open for 2 years, and I've been receiving ketamine infusions probably about every 8 weeks from my initial series. And it is always a reprogramming. It's a reset. And I really feel like right now, utilizing something that like ketamine, which is not covered by insurance companies, because we don't have the ability to go and do the large studies with ketamine. It's an old drug. And like you said, we don't need to get into conspiracy theories about that. But there's a reason why J&J was able to twist the drug on its axis and then come out with Spravato, which is ketamine in a different state. And so you can go to your psychiatrist, ask for Spravato. It's covered under your insurance company, but it still ends up being hundreds of dollars per visit. And it's not as effective. It's not as strong. And it seems to have fallen off the edge of the table there for the effectiveness of the treatment. And so, you know, like the crazy thing is that right now we're looking at 80% of the companies that were in the development and research of mental health medications no longer are putting that money into it, because I believe they know what is coming, and what's coming is the psychedelic movement.
Yeah, and Portland just legalized pretty much most
Right.
most psychedelics, and that's going to roll out, and eventually, like we have cannabis stores, we will have psilocybin stores, and
Right.
I think about the impact that that's had in my own life. Doing these almost heroic doses of
Right.
psilocybin, having these associative memories placed in the boxes that they need to go, thus removing them from my shoulders, feels very much similar to the experience that I think one may have with ketamine.
Yeah. Well, and I think you're right. And I think that what's important to remember is that ketamine, when we provide it IV, we have someone in the room with the patient at all time. They're in a recliner. They have an eye mask on. They have a noise, binaural beats or just noise canceling music, and they're monitored the entire time. Heart rate, blood pressure, pulse oximetry, which is oxygenation. And so patients feel safe. And this experience is going to spill over eventually when we have psilocybin and MDMA at our disposal for clinical use. We're going to have to coddle it and utilize it in a clinical way, which again, I'm like you, I've experienced many different psychedelics, and in those states, it's more of a feeling with friends or outdoors, or it feels more shamanistic and ceremonial than in a clinical setting. And so I would say that in our clinic, we try to provide that space for each patient to be able to experience it on their own without any communication. We allow them to be in the state of dissociation and not disturb them. That's for mental health providers who are familiar with it, because in low doses, you can do some fantastic work, ketamine assisted psychotherapy. But it takes a psychotherapist to be able to do that, or someone who is trained to be able to provide that service.
Yeah, and I think about my own experience in psychedelics. The most impact I believe that they ever had was when I was in a sensory deprivation tank,
Yeah.
floating by myself for like 4 to 6 hours, and
Yes.
just having these deep dives into my subconscious and looking at all these memories. It was literally like the Matrix at time, where I was like diving into these moments, reframing them, reprocessing them, getting where they needed to go, and then coming out and then having these conversations with my then therapist about the impact of it. One of the things as we start to wrap up here is you mentioned integration, and
Yeah.
and I believe that is without question one of the most important things that you can do in any healing journey when it comes to mental health elements. What does that mean in the context of ketamine?
Uh, what I believe is that it has to be, again, individualized to the patient. If it's trauma, as you know, EMDR combined with ketamine, especially if they can go to their EMDR therapist within 24 hours, fantastic work. We see huge benefits and results in patients who are plugged into those therapists ahead of time. But it's really, we have also another, we're in COVID, and so we've touched and reached out to a company called Being True to You, and they have ketamine assisted psychotherapists who can provide that therapy, just telemed or Zoom calls, and to be able to help those patients be able to work through and get their integration that way, which I think has been very beneficial for us, because it provides something that we don't have a lot of those providers available here in Austin. And so being able to do it remotely at again, immediately after having an infusion has been very beneficial. So for other patients, I think it's anything from gardening to journaling. If writing is amazing as far as being able to spill your thoughts out onto a page, and seeing what your progression is, because your thought processes change over periods of time, and to be able to go back and read where you were, there's a sense of gratitude of being able to know that I've made tremendous progress. I've talked with patients, one more thing is that I've talked to patients that feel like a month out or 2 months out, that they feel as though they're slipping, or that they're feeling like they're going back. And I say, well, go back and think, revisit that place that you were when you first came into the clinic. And right now you don't have ketamine in your system, because the infusion is gone, and we can, utilize something called a lozenge or a troche, and it's a smaller dose that a patient can be prescribed when we're trying to help them through the most difficult aspects of, say, depression or anxiety at post infusion, where they're doing the work and they are maybe the next day feeling such the difference, and there's no ketamine in their bodies. It's not like an SSRI where it's long acting and it's changing your brain architecture for the worst. It's actually reforming those neural connections, so that to remind patients that that's the difference. Because patients that come to us with SSRIs, they're automatically thinking that it's related to the drug, and negatively. Does that make sense?
Mm-hmm. Yeah,
Yeah.
absolutely. And I think that's such a valid point. I'm glad you brought that up, because and again, it's going to be different for everyone.
Yeah.
I would be remiss if I didn't step into asking you about the power of gratitude in your life. One,
Yeah.
I see the poster behind you,
Yeah.
but also you've mentioned gratitude in your own life a few times, and I'm a proponent. Sign me up. I think it's so incredibly necessary. Even if your life isn't as great as you think it is, I believe that there's still always something to be thankful for. What role does that play in your life?
I wake up and I have a practice of reading. I'm not sure if you're familiar with the Daily Stoic or Stoicism, or Ryan Holiday. He wrote a great book, and it's broken down into 365 quotes, essentially, of all of the great Stoic philosophers. And that's where I start, because it's an empowering way to put a positivity in your life right out of bed. And I start with, my health, and then I go to my family. I have 2 sons. I have a wonderful partner in life and in my business, and she is just an absolute godsend to me, because I know that when I'm struggling, she is my pillar, and I just have such gratitude for someone else in my life that shares the same philosophy. And that is, and I teach my sons every time that we sit down to have dinner, that's part of it. Everybody has to go around and talk about what they're thankful for in that day. And I think that's where we need to sit, at least temporarily, because when, as with the Stoics, we can only control what we think and how we feel, and no one else is going to be able to take that from me.
Yeah, I love that. I mean, I resonate with that in such a real intrinsic way. Ken, this has been absolutely amazing conversation. Before I ask you my last question, tell
Sure.
everybody where they can find you.
So the clinic is Illuma. It's 2 L's and 2 M's. So it's ILLUMMA.com or at Illuma on Instagram. So we have lots of great quotes and explanations. They can go to our website, which is filled with articles and studies on information as to how ketamine works, how an infusion looks like, goes into much more detail. You know, we answer every question, every reach out, whether they're in Austin or if they're, in another country, because, we're a believer in the grassroots explanation and development of these therapies.
Beautiful, beautiful. And Ken, my last question for you is, what
Sure.
does it mean to you to be unbroken?
I believe that unbroken to me is resilience. It's standing in a place where you know that you've been through absolute hell. Your armor may be battered, but you're standing tall. Your sword is sheathed, not unsheathed, and you are ready to face the day because you've been through everything and you're ready for life.
Man, that's beautiful. Literally have goosebumps if you could see them. I love that. I resonate again. Ken, amazing conversation. Unbroken Nation, please check out Illuma. Follow, like, subscribe, leave a comment and a review. And until next time, my friends, be unbroken. I'll see ya. Thank you so much for hanging out today with the Michael Unbroken podcast. Before we head off, do me a favor, please. Hit that like or subscribe button, leave a comment or review, and tell a friend. It would mean the world to me. And just so you know, I read every single review. I listen to your questions. And if you need to, you can reach out to me directly anywhere on social media at Michael Unbroken, or email me directly to michael@thinkunbroken.com. Remember, my friend, though trauma may be our foundation, it is not our future. Until next time, be unbroken. I'll see ya. Hey, my friends, we will be right back to the show. But I have a question for you. Are you struggling with the impact of childhood trauma? Well, know that you're not alone. I'm here to let you know that I'm starting a brand new weekly coaching group that includes a year of live coaching, accountability, support, habit and goal setting, and more. I'm starting a waitlist for the group right now, and I'm only taking a handful of people. And I'll let you know that through this personalized coaching, we'll work together to help you understand how your childhood trauma has shaped your beliefs, behaviors, emotions, and will help you create a roadmap for healing and growth. Right now, you can schedule an absolutely free coaching session with me and get put on the wait list if you go to thinkunbroken.com. My friends, it's your time to turn your trauma into triumph, breakdowns into breakthroughs, and become the hero of your own story. And I'm here to support you in doing that. Just go to thinkunbroken.com to register for a free coaching call with me and to get put on the wait list for the brand new weekly coaching program.
Welcome to the future of legal THC, Mood's THCA flower. It's the most potent breakthrough in the world of federally legal cannabis. And now you have 10 high-inducing strains of this smokable flower to choose from at HelloMood.com, the best online dispensary that ships discreetly to your door. Great for beginner and veteran users, the experts at Mood have tailored different strains for curated moods. From euphoric and energized to creative and focused, Mood delivers the highest quality THC products you can trust. However you like to take THC, Mood enhances awe-inspiring experiences with versatile products that go with whatever mood you're ready for, like their great-tasting gummies, convenient pre-rolls, classic flower, and so much more. Try Mood's new THCA flower today, and for 20% off your first order plus a free pre-roll of THCA flower, go to HelloMood.com and use promo code podcast20. That's HelloMood.com, promo code podcast20 for 20% off your order and a free THCA pre-roll.